Brush up on your dental care with today's professional, featuring Lima Dental Associates, where you'll always receive state-of-the-art technology with state-of-the-heart care.
Good morning, everyone, and welcome to today's professional. Today, in the studio, Dr. Wesley Shankland from Lima Dental Associates. Good morning to you.
Good morning, George. Nice to see you.
Good to see you.
Thank you.
What does he want to talk about today?
Well, let's talk about osteoporosis.
Now, isn't that a back disease?
Well, that's a great question. It can be a back disease. Osteoporosis is a disease. It's in a whole group of diseases called ischemic bone disorders. What it basically is a decrease in quality and density of bone. So in the back, my dear mother, at the end of her life, she had 2 or 3 vertebrae that collapsed without any trauma. Osteoporosis. A decrease.
Got brittle.
Yeah, that's exactly, it got brittle. So that can happen in any bone that has bone marrow in the body, so basically any bone. So what happens is there's a decrease in the quality and the density of the bone to the point where it can fracture easily. You and I have known people standing, talking with somebody, and all of a sudden their leg fractures, their hip fractures, older people. We all remember Bo Jackson, a great football and professional baseball player, and he fractured his hip playing against the Bengals and tackling, he broke his hip. Well, that's because he took a lot of steroids. So people who take a lot of steroids, people who have certain systemic diseases can cause osteoporosis, decrease that quality and the density of the bone so it fractures easily.
Do patients question why their dentist needs to know about osteoporosis?
Yeah, they do, because they want to know, why would a dentist want to know that? Well, if you think about it, dentistry is almost a subset of medicine like dermatology is, like ENT is. We all need to know what kind of medications you're taking, because certain medications like Boniva or Fosamax, which people take today, to increase the density, to build this up with a good diet and try to strengthen your bones, can cause detrimental effects in the mouth if we do surgery. Sometimes if we do certain types of surgery in the mouth, then this osteoporosis can actually reverse and cause an opening of the gums, a bad infection. And we have to know that, because we don't want to do certain things to a person's jaws and cause a problem that's much worse than if we left things alone. So we need to know their history, we need to know what they're taking, we need to know what kind of condition we have with the patient before we do anything.
Well, I can see now, yeah, because anything could affect the jaw. So.
Aggravate it, make it very detrimental, very serious to the patient.
Any last words?
Keep smiling, sharing, and caring, George.